All right, 7:30 on the dot, and you may have noticed that we are all wearing red today. It's not a coincidence, very much intentional. Today is National Wear Red Day for American Heart Month, and we're going to break down some myths of heart disease for women. Joining us now is Dr. Barbara Srichai-Parsia, the Director of Women's Heart Health Program at MedStar Health. Good morning to you, Doctor. Thank you for joining us.
Thank you for inviting me.
Absolutely. You know, this is such an important topic, and I think people underestimate how important and how urgent it is. So we want to break down these myths because they can save lives. Let's start with the first one, and I think it's probably among the most common. Heart disease is a man's disease.
Yes, I get that all the time. I'm a female. Heart disease doesn't affect women. When we think of heart disease, first off, I think most of us think about heart attacks, but heart disease encompasses a lot of different disease processes that affect not just the heart, but also the blood vessels. And while heart attacks are the most common causes of heart disease, there are lots of other heart diseases that can affect both men and women, and there are even female-specific heart diseases that we should be aware of, such as you may have heard the term microvascular disease or broken heart syndrome that does tend to occur more in females than in males.
This next one, women should worry about breast cancer and not heart disease. Obviously not true. Why is that?
Well, I think we focus on breast cancer because the Cancer Society has done a great job of increasing awareness of breast cancer. Breast cancer also tends to be more female specific, so I think women are very sensitive to that. However, it's interesting to note, though, that heart disease is the #1 leading cause of death, both in men and in women. In fact, it's by an order of magnitude. So heart disease affects nearly 50 million women in the United States, whereas breast cancer affects probably almost 4 million.
I think that's probably...
As well, heart disease kills about 300,000 women each year in the U.S. compared to 42,000 in breast cancer. So it's a magnitude of difference. Yeah, so it is very important.
I'm glad you mentioned those stats. Every time I see it, every year we talk about this, it's just stunning. It really puts things into perspective. This next one, I feel fine and therefore can't have heart disease. I think we say that about a lot of things. Why is that not true?
Well, first off, I think that messaging of I feel fine, what does that mean? Because heart disease can present differently in men and women. And I think when people think about heart disease, they're thinking of that classic, chest pain, that crushing symptoms, that's what heart disease is. Women actually present a little differently than men, and may not necessarily have that kind of chest pain symptoms. In fact, women may describe something more like pressure or burning. It may not even necessarily be in the chest. It may be symptoms that are in your stomach or in your jaw, and that could very well be a sign of underlying heart disease. So the other thing, another statistic to note is that 2 out of 3 women who died suddenly from heart disease actually had no symptoms or no relatable symptoms that they thought were from the heart. So that myth definitely, I wouldn't trust that. And I wouldn't just rely on that only to say I don't have heart disease.
Absolutely. So going from feelings now to maybe age or how you look, this next one, heart disease only affects older and unfit people. That is a myth.
That is absolutely a myth. Heart disease affects all ages. We see from the young to the older, from healthy people who run marathons on a regular basis to people who are living a sedentary life. It affects everybody. I think what's important to note is the things you do when you're younger could have an effect as you get older. So it leads to plaque buildup in your heart arteries if you're leading a sedentary life, not controlling your risk factors, such as diabetes or high blood pressure, that we see that later on. So while, yes, it is true that as you get older or if you lead a more sedentary life, we do see heart disease more often, it absolutely doesn't escape people who are young and fit.
This last one, just as important as the others. I already have heart disease, and therefore there's nothing I can do about it.
Again, another myth to dispel. So I already have heart disease. That's the first step, just even an awareness and recognizing that, yes, I do have underlying heart disease. But, I quoted you numbers as to how many women die each year. It's the #1 cause of death in women. Knowing is the first step. Doing something about it to reduce your risk of death is the next step. So recognizing your risk factors, controlling them, leading a heart-healthy life, heart-healthy diet, and preventing that leads to prevention of deaths in the later time.
Yeah, absolutely. I know this is just the very, very beginning. There's so many questions I could ask you, from what your options are to resources, things like that. But I'm glad we started the discussion. Hopefully folks can continue it at home. Dr. Barbara Srichai-Parsia, the Director of Women's Heart Health Program at MedStar Health. Appreciate your time and expertise this morning. Thank you.
Oh, thank you for inviting me.
Absolutely. 7:36.